Hey everyone, welcome to the podcast. Where can you get the best medical information anytime, anywhere? Right here on the smartest doctor in the room. The goal of this podcast is to bring the top experts in all areas of medicine right to your smartphone or listening device, and also on YouTube. Disclaimer: this podcast is for informational purposes only and is not intended as personal medical advice. For that, please consult with your trusted healthcare provider. Now, we all are trying to focus in areas to improve our health. We check our blood pressure. We want to know what our cholesterol levels are, even devices that tell our oxygen levels. Now, in holistic medicine, gut health is the hot topic. But what about our mouth health? Normally, when it comes to our mouth or dentistry, we seem to only pay attention if we have a toothache or a cavity, or if there's a cosmetic issue where everybody wants the whitest teeth. But what gets overlooked a lot by everyone, but especially medical doctors, is that the mouth is an immune organ. It's the beginning of what we call the alimentary canal of the gastrointestinal system. And the balance of the bacteria, the viruses, and fungi in our mouth can play a very important role in our health. So my guest today, Dr. Nezar Al-hebshi, is an associate professor of the Kornberg School of Dentistry and the co-director of the Oral Microbiome Research Center at Temple University in Philadelphia. Aside from his dental degree, he also has a PhD in microbiology. So I think he's the perfect person to hopefully teach all of us how important it is, our microbiome in our mouth. So it's my pleasure to welcome Dr. Nezar Al-hebshi to the podcast.
Thank you very much, Dean, for the invitation. I'm looking forward to a very fruitful discussion here.
Okay. I always like to usually get people's background. So I'm interested, especially in yours, like why you decided to become a dentist. And then I see you went on to study, and I think you got a PhD in Norway in microbiology.
Right. I had, that's an interesting question. And for me, it has been a very long journey because I got trained as a dentist in my home country, that's Yemen. So I'm not US trained. I'm not a US trained dentist. Mm-hmm. And also as a PhD, I got my PhD from Norway. So it's at that point where I moved away from clinical practice to science. And from that point on, although I kept some connection, all of my research is connected to oral health, to dental diseases and how they relate to systemic health. But I remain focused mostly on research and science and academia, teaching also students rather than doing clinical practice. So that kept me moving from one country to another. So started with Norway, then back to my home country for some time, and then to other countries in the Middle East before. And it's the work that I did on the oral microbiome that gave me the ticket to travel all the way to come to the USA to join Kornberg School of Dentistry, where
let me ask you, like when you grew up in Yemen, like did you think you were going to be a practicing dentist? I mean, was that what you thought? I assume originally.
Oh no!
That was just that was just a way. You weren't like just a way into the science.
Sometimes in countries in that part of the world where opportunities are limited, so you usually follow whatever door opens for you. You see.
I understand. Sure.
At one point, I wanted to be an engineer. I was doing great at math, and then I found myself doing dentistry, and it's there where I started to fall in love with science. Although I was doing good with clinical practice per se, but I had more passion for science because at the end of the day, clinical practice becomes very routine. You do almost
of course,
with day, which is great. But I felt that I want to do a bit more and to discover and to make sort of discoveries. This is what motivated me to pursue a master's and a PhD. And that got me into the world of science and research.
Yeah, that's very fascinating because you'll hear also a lot of dentists. I understand a lot of them do the endodontistry. There's a lot of money to be made in that. People all are very focused on the cosmetic end of dentistry today here in the United States. So, absolutely. But it's interesting because I think it's sometimes, again, some of the best, medical work done in dentistry probably is done outside of the United States where they're not as focused on this. Okay, so let's get into it because I'm really interested. I deal a lot with my patients in the functional medicine, the immunology of my practice. I'm constantly looking at their mouth and I'm looking at things, if patients sometimes develop what's called oral thrush from Candida overgrowth. Obviously, I'm looking to see their gums, or if there's any oral issues. And obviously, it's very important in Chinese medicine. Like, they look at the tongue. So let's go through the anatomy a little bit. I mean, in the mouth, we're dealing with the teeth. Obviously, we're dealing with the tongue. We're dealing with the gums, the gingiva.
Right.
What is,
Yeah.
what is important in there? What are most people, doctors, and even the patients don't appreciate?
Yeah. The fact remains that the most commonly encountered diseases in the oral cavity are cavities, which is dental caries, which affects the heart tooth, the hard dental tissues, and then gum diseases, periodontitis, that affects the tissue around the teeth, the tooth supporting structure, which is the periodontitis. So these remain, and gingivitis, and these remain the most commonly encountered. So it makes sense that people give all their or most of their attention to these diseases. But what people do not maybe appreciate, that these are not disconnected from systemic health. So that's one
Yeah,
area.
we're gonna get into that.
Yeah, the other area within the oral cavity that people do not maybe appreciate is what's behind these diseases. What is the complexity
Well,
of microbes that
well,
account for these diseases as well?
Right. So where are them? This is to me also what I think about, because you're bringing it up too. So like when you're talking about the gums, the gingiva, that's an area where there are obviously the microbes, right? They're in that, it's not only so much the bone on the teeth, I assume, but
E-
it's the gums that are more of the live tissue. Well, they're all live tissue, but the gums, from what I understand, like, when kids eat a lot, if they eat a lot of sugar, they build up too much bacteria, or adults, if they don't take care of it, when we say get gingivitis, what is that? Is that the bacteria building up, from poor
Yeah,
health?
yeah. Then let me start with this.
Yes,
So the
sure.
the oral cavity, the mouth, is a home to billions of
Mm,
microbes,
mm.
mostly bacteria, but some fungi and some viruses. And we have many types of these bacteria. Um, Studies show that there are around 700 types of bacteria that can be found, not necessarily only 700 in one person, but in different
Yeah.
people. So maybe at least maybe 50, 60, 70, up to 100 of these are found across all people, but the others may be found in some people, but not in the others. And these microbes or bacteria live in communities, exactly like we live in cities. So there's lots of interaction between these microorganisms. It's not like just every bacteria is on its own. Now they interact from very
Right.
complex communities, and they're found everywhere. So they colonize all the exposed surfaces of the mouth. So the dorsum of the tongue, the floor of the mouth, all these tooth surfaces, the cheeks, gums, everywhere that is
Everywhere.
exposed. Of course, anything that is hidden below the gum, below the tissues, or below the mucosa, like bones, are typically sterile. So bacteria are
Hmm.
just found in the outer surface that are exposed to saliva. So bacteria are forming these complex communities on the surfaces, and also many of them are bathing in saliva, and that helps them move from one place to another within the oral cavity.
Now we need this bacteria because it's interesting. Like in the gut, we do need some of those bacteria in our mouth because they're
Yes,
beneficial.
certainly. For the most part, they are. I mean, I mentioned we have billions of these bacteria,
Right.
right? And we
Right.
don't, we for the most part, we don't feel them, right? It's
Right.
that we have infection every single day, we
Right.
have a problem. So that means that they are there serving a function. They benefit from us, but we also benefit from them. So it's a mutualistic, beneficial interaction between us and these microbial communities. So they serve us they provide us with lots of benefits. For example, these bacteria are required, or microbes are required, to train our immune system. They are required there. They provide the challenge that the immune system needs to develop. And they found that in bacteria, in mice, where bacteria was removed early in life, they found that these mice do not develop their immune system well. So we need this bacteria
So we
to
do,
help.
right? So
Yeah,
we do need, because again, with somebody who's got, like, let's say, an autoimmune condition where they have severe dry mouth, that's a problem, right? Because they don't have the right bacteria or saliva in the mouth,
right.
for the really for the balance of the microbiome.
Exactly. And another example of how bacteria can be beneficial to us. These bacteria colonize all these exposed surfaces in the mouth. So when a pathogen comes in, the pathogen doesn't find a place for it to colonize. So that's we call this colonization resistance.
Right.
So that's another example where our own bacteria or the bacteria that live inside the mouth protects us.
So, just as an example, this is really interesting. There's a lot of ways to go with this, but so if somebody ate some food, for example, that may have had some bad bacteria, it's possible that the mouth might begin to neutralize that even before it goes further. If you're chewing the food or whatever, before it goes down further into your stomach, or no?
Yeah, that's a good example. But usually, it's in that case when we have a bacteria that causes diarrhea, for example.
Yeah.
Most of the time, it's what happens is that the good bacteria in the gut could block this bacteria from colonizing. So that's why you need certain amounts of bacteria, of this pathogenic bacteria, to be able to overcome that challenge, that resistance. You get what I'm saying?
Yeah.
Yeah. Now, go ahead.
No. So what about also like when people get plaque? Because dentists used to say, okay, plaque is bad. Obviously people don't like it because it looks like yellowish, whatever. Too. Is that have any benefit, or is that more bad for the gums and the teeth?
That's a great question. So plaque is just one
it's bacteria,
form,
right?
Yeah, plaque is just one form of these microbial communities. I mean, I said
That's what.
microbial communities are found on the tongue. They are found on the tooth surface. So on the tooth surface, they become as a very thin film, which we call, or viscous film, which we call as dental plaque, which basically is, again, I mean, the same rule applies. That in principle, most of the bacteria, even in plaque, are not harmful. The majority.
Okay.
And as long as, and this is what I wanted to emphasize, that these microbial complex and these microbial communities are very complex, but they are very stable. And as I mentioned, they serve the host. So it's a beneficial relationship between a mutualistic relationship between the host and the microbes, including those in dental plaque. But now there is a point where this balanced microbial community sometimes breaks. And this is what we call, let me bring here one term here, is that this microbial community as a whole is called microbiome. Okay?
Right.
I'm sure that the audience are now familiar with this.
Familiar with this,
it comes
yes.
from all over the news media, social media. So microbiome is just the collective term for all the microbial community in a particular body site. So in the oral cavity, it's called oral microbiome. And as I mentioned, it has mostly bacteria and some fungi and viruses, and it is stable. And overall, it doesn't pose any danger to us. On the other way around, most of the time, it's a mutualistic relationship. But sometimes this balanced state, or balanced, or we call it homeostasis, or some people will call it eubiosis or normobiosis, that refers to a balanced microbiome that is compatible with health. Sometimes this balance is lost due to different reasons. And when this balance is lost, some of the tiny minority of bacteria that are potentially harmful, but they are controlled because they are in a very small amount, can overgrow. And now this microbiome becomes very imbalanced. And once the microbiome becomes imbalanced, then we start to have disease. And the typical diseases that are caused by imbalanced microbiome or imbalanced microbial community are dental caries or cavities, and gum disease and periodontitis. And that's why people say, okay, let's remove dental plaque, because it's at that point where dental plaque is becoming represents an imbalanced, or what we call as dysbiosis or dysbiotic microbial community. And it's only then when it becomes really bad and can cause disease, and where we need to remove it as dentists by scaling, for example, using ultrasonic scalers, or we encourage or teach the patients to do brushing and flossing to mechanically remove these bacteria. Although we know that most of these bacteria are typically not harmful, but we got to a point where we lost this balance, and we have more pathogens or potentially pathogenic bacteria. So we need to keep cleaning to prevent disease.
It's interesting, because again, my background's in immunology, and I teach at the medical school here in New York, and I teach about immune deficiencies. So there's a couple of very interesting rare immune deficiencies where the kids get swelling in the gums, and
Right,
sometimes bleeding. And as you probably know too, in leukemia,
right,
again, bleeding of the gums is a very clinical initial symptom in some cases. And
right,
what I teach the students, because it's funny, I had to relearn this, was that I believe like several million or a billion white blood cells transverse through the mouth
right,
every day,
right.
which it just shows you how active, the immune system is in the mouth.
Right.
Um, what about, well, maybe you could talk a little bit too. What are maybe some of the examples of, I know dentists don't usually check this, but of the good bacteria? Like I was looking up a list of things like lactobacilli, rutin, lactobacillus lacellarius, lactobacillus paracasei. I don't know. There's a whole bunch of them. Like, is there such a thing as, like if you were, again, this is your kind of a little bit your research area. If you
Right.
were to find the healthiest people walking around Philadelphia, or I found the healthiest people walking around New York, would some of them have a certain percentage, or predominance of some of these bacteria, or not
Yeah,
necessarily?
I mean, if we will take the average microbiome, certain bacteria tends to be higher in people with healthy mouths compared to diseased mouths. So there are certain bacteria when they have higher abundance, we feel this looks good. This is more of a balanced microbial community, and there are other bacteria that are red flag. If they increase, that means that we are facing sort of offset of disease. And the specific types of bacteria differ from, particularly from cavities to gum disease. So these are two different categories of bad bacteria that can be associated with either disease. But on the health side, some species of streptococci, not all of them, are overall considered to be associated with health. Some species of Neisseria, of Rothia, of Haemophilus, for example, these are probably major for generally health associated species. Once we start to see increases in bacteria like Porphyromonas gingivalis, which is the a typical oral pathogen that causes gum disease. Once we have Treponema or Treponemas, Tenerella, and these are all related to periodontal disease. But one other bacteria that is really, or a group of bacteria that are implicated or linked to dental caries or to cavities is called Streptococcus mutans. I mean, this is a
I've heard of
very
that. Yes. Hmm.
extensively studied bacteria, and its role in dental caries is quite well established. And then you mentioned lactobacilli, and here where we have to be careful, because many times lactobacilli are available, some strains of lactobacilli are available as probiotics.
Right. Right. Hmm.
That's really good in the context of gut microbiome. Okay. But
Hmm.
we have to be a bit cautious when it comes to oral microbiome, although some of these have been found to maybe help with gum disease. But in dental caries per se, in cavities, deep in cavities, lactobacilli are contributing to the disease process. They are bacteria that produce high amounts of acids. So we need to keep the two scenarios a bit away from each other. Gut microbiome and gut health is something, and once we start to apply this knowledge to oral health and to oral microbiome, it may be a different scenario, and it is still under investigated what sort of probiotic we can use in the oral cavity.
Yeah, I want to get I want to get into that because I had my brilliant idea for a friend of mine who has a toothpaste company, but I'll get to that after. I want to keep the listeners on their edge of their seat. But let me ask you this:
Right.
that you know, when we think of the mouth also, as far as the thing is it's so accessible. Do you know what I'm saying? It's like the skin.
Right.
Dermatologists are lucky. You see a rash, you can scrape it and culture it.
Exactly.
I mean, it's a little more invasive when a gastroenterologist has to put a scope down somebody into their stomach or for
Yeah.
their colon to
Right.
find out what's grown there. The mouth, they open up.
Yeah, or they will
What's
rely,
going
I
on?
mean, in the case of the gut microbiome, they will rely on a fecal sample, which is which is site not specific because it carries everything.
Yeah, that's a problem. I know people ask me I mean, just as an aside, patients ask me all the time, "Oh, don't you want to check my stool? I want to check for this." I said, I've talked to a lot of top experts, on this show, and most of them feel the stool is quite suboptimal for really getting an idea of what's going on in the gut health. So you make a good point. What about also like what we call immunoglobulins, like immunoglobulin A, or cytokines, like the immune hormone cells in the mouth? Is there anything, I do a lot of work with what's called sublingual allergy immunotherapy, where I treat patients for food allergies, have these severe food allergies with these drops. And sublingual is a great area because it gets it right into the system, bypassing the liver.
Right.
And it's interesting, in some of the research that's done, they'll measure the IgA, or IgG response to the immunotherapy treatment. So I was just curious again too, if that, anyway, immunoglobulins play a role. Like, I mean, if somebody's immune deficient, for example, will they be obviously immune deficient in the mouth as well? I mean,
I mean, if somebody has a systemic disorder with generalized immunodeficiency, certainly that will reflect in the oral cavity, and people will have higher susceptibility to oral infections as well. So
I guess that makes sense because I mean I should have answered my own question. Like I trained in the AIDS epidemic in the late 1980s, and we obviously saw many patients with HIV/AIDS who had oral candidiasis or thrush.
Exactly.
So where is that coming from? Is that coming from the lower GI, or is that in the mouth? I'm just curious for myself too, because I see still a lot of patients that have oral candidiasis. Where's that emanating from?
Candida is found as a minority in the very small amounts as a commensal in most people. So it's found in very tiny amounts in the saliva or on the tongue of some people, and it's we don't feel it. It's commensal. So if we screen 100 people, normal people who have no symptoms of thrush, you will still see some candida in some.
Well, right, there's supposed to be some there, but is that like similar to what's in the gut, like in the stomach? Is it similar in the mouth and the stomach, or is there like a different gradient? I mean, that
I'm not sure about the gut, but as far as the oral cavity is concerned, once what happens is that the immune system prevents candida from overgrowing. So once you have a patient with immunodeficiencies like HIV, then candida is an opportunistic pathogen. It starts to overgrow. Another good example, which you mentioned over email, where candida can be also an opportunistic pathogen and can result in infection, is when we use broad spectrum antibiotics for a long time.
Right. I see this, Dr. Al-hebshi, I see this all the time. Like when I have patients that have come to me that have been on like doxycycline for months for acne, or they've been on something like that too for Lyme disease. And then they come and they're like, I'm getting recurrent thrush, I'm getting rashes, those kind of things.
Yeah, and exactly. This is a very good example. You remember I mentioned colonization resistance, where bacteria will stop pathogens from colonizing and growing. So what you are doing when you give antibiotics for a long time, you are clearing bacteria, and bacteria are usually the ones that stop candida from overgrowing. So when you're removing all these bacteria, candida is on her own or on its own, and it starts to overgrow.
So it starts to flourish. Yeah. So it's not being inhibited by, it's not being kind of crowded out by the other bacteria.
Yeah, because usually bacteria antagonize candida, so they limit its proliferation.
They do what? I'm sorry, can you say that again? They do what to candida?
They antagonize. They block.
They antagonize it. Okay.
Yeah, so they
interesting.
they limit the overgrowth of candida. So.
And one other thing I just have to ask you, because you published a paper on this about something about with iron. Increases and causes. So I'm a little bit confused about this, because most of the time I think of like being iron deficient being a problem with the immune system. But in your paper, you were saying something to the effect that if someone has too high an iron load, that they're more prone to candida or yeast overgrowth?
Yeah, I mean, that paper is when I had a very small contribution, because the expert on the principal investigator on that paper is Dr. Puri, who co-directs the same lab as mine. So he's the one who does most of the work on candida and how iron levels, environmental iron levels, can modulate how pathogenic or virulent candida is. And he shows that when you take iron away from candida, that makes it less virulent in many ways.
That's interesting.
So it's his hypothesis that if in a patient with high levels of iron for whatever systemic condition, this may result in more virulent infections. So yeah.
Because I see a lot of young women, and it's like actually I have the opposite problem. A lot of young women who have heavy menstrual cycles, they have sometimes very low iron and low ferritin iron stores. And again, what I know from my medical background in immunology, unfortunately, being deficient in iron can actually make your immune system weaker.
Oh, okay, yeah. If you look at it from that side, because you have to put. I completely agree with you, because I mean, most of this work is done on mice or in vitro. So where you consider humans, then you have to you have to take into account also how the immune system is affected by changes in iron. So it's a multifaceted issue.
Let me ask you about breath. And people obviously are always worried about what we call halitosis, bad breath. In medicine, we were trained, hopefully, using all our senses. Today in medicine, we have all our technology, our ultrasounds, CAT scans. People don't examine patients anymore. But there was a time, and I remember when I did my medical training, the doctors were very adamant, and hopefully teaching us well. Like when you're next to the patient, notice their breath. Do they smell ketotic, which has sort of that sweet smell? That could be from a diabetic, or in a patient that's got liver disease. They have, so there's certain medical conditions, but of course, patients are also really concerned about, God, my breath doesn't smell well. There's a whole multi-billion-dollar industry of getting people to have minty, fresh breath. What is it that goes on in general with halitosis bad breath? Is it coming from the gut lower down? Is it from the mouth, or does it depend?
That's a great question. Again, I mean, I'm not an expert in the systemic aspects of halitosis, but what I know for sure is that that accounts for only 10 to 15% of all halitosis cases.
What does?
So the systemic conditions like diabetes, liver,
yes, right. Those are rare. What about the more common bread and butter?
85% of halitosis cases are due to oral or mouth problems, and most of the time the bad smell comes from the dorsum of the tongue.
The dorsum of the tongue.
Yeah, where bad bacteria that produce sulfur-containing volatile compounds is the reason why we have this bad odor. And also some of the bacteria that live around the gum, also especially in cases of very severe periodontitis or gum disease, also can produce volatile compounds that contribute to halitosis. And it's very important thing here is to make sure that that halitosis is really halitosis, because many times there is no halitosis and people just perceive they're either they call it halitosis or halitophobic. They just think that they have halitosis.
Okay.
And if they don't have, they are very sensitive to the least amount of any odor that comes out of their mouths, and they think that they have halitosis, and when in fact they don't have.
Yeah.
So that's a very important.
Yeah. No, it's but it's something that people are very aware about, I guess, in our society, whether it's about body odor or their breath. So I thought I had to ask you on that one. Let me ask you this too. Let's go into, which I'm sure a lot of listeners really want to know too, about oral hygiene products. And as I was alluding to earlier on, I have a friend of mine who started a toothpaste company. I had him on the podcast a couple of years ago. He was a dentist, but now he just runs a business. And he was like putting some vitamins in the toothpaste. I said to him, I think the game changer here is if you find the right probiotic that gives somebody really good health. So anyway, what do you recommend as far as toothpaste? Really, besides we have all the whitening toothpaste that we know. What about good oral health? Because patients ask me all the time, Dr. Mitchell, what's the good probiotic I should take for my gut health?
So now, let me emphasize one point. The traditional approach to treat and prevent oral diseases like periodontitis, gum disease, dental caries is to remove bacterial biofilms or dental plaque that accumulate on the tooth surface, right? And this has been the objective of what the dentists do, and also what the patients are instructed to do through toothbrushing and flossing. And I think this will continue to be the standard care for some time as new evidence builds up in favor of using an alternative approach where we, instead of mechanically removing, because what you do with brushing, regardless of what the toothpaste is, because it provides a sopping action, so you're just mechanically removing bacteria. That's the major objective of brushing. Now, some of these are medicated, have some ingredients that can have some biological effects, but what is evolving now over the last 10, 15 years, and that's in parallel with the paradigm shift in our understanding of how microbes are involved in dental caries and periodontitis, the concept of balanced versus imbalanced microbiome. So one potential or emerging strategy to control dental disease, instead of mechanically removing all bacteria, good and bad, maybe there is a way to keep the balance. Okay, let's bacteria be there, but let's make sure that the good ones have the upper hand, and we keep the pathogenic at very low abundance, and we're done. If we are able to keep that balance and stop any break in the homeostasis of microbial communities, then we can improve oral health in a novel approach. But as I mentioned, this is still evolving. Lots of work is being done. Some products are now in the market, some that could be effective, some that will maybe eventually prove not to be effective. We continue to study this, but it's certainly something that is coming.
I would think it's a hot topic, yeah, because people, again, they're taking oral probiotics, just swallowing, it's going right down into their stomach and intestine. Yet in the mouth, as we say, it's a very active immune organ. Just out of curiosity, too, I mean, I've heard back in the day, some people used to say like baking soda was a great toothpaste. Like people hardly ever got cavities. I don't know if it kills bacteria. There's also a natural product called neem. I don't know if you're familiar with that. It's like a natural product that has sort of some antifungal, antiviral properties. I mean, versus the typical mouthwashes. Or are you pro or against them? Because a lot of them have like a little bit of alcohol. Sometimes they have sweetener, like usually artificial sweetener, because people don't want sugar. Like what would you do for yourself if you're trying to have, somebody went to you, Dr. Al-Hebshi, I want to follow your program. What do you do for optimal health? And this is a book, by the way, that you can write.
Yeah, exactly. I'm still,
bestseller.
until we have strong evidence for effectiveness of certain approach, I will continue to do the traditional approach of toothbrushing and interdental flossing. Mouthwashes make you feel fresh,
Right.
fresh breath. They don't necessarily mean that if you have halitosis, for example, that they're treating halitosis. Maybe they're just masking the smell.
Exactly, right.
And because they're broad spectrum, you don't know how they're messing with your microbiome. Actually, there was a study that showed that using mouth rinse twice a day changes the tongue microbiome, killing good bacteria. Particularly, I'm going to connect this with your question about pre-probiotics, bacteria that are nitrate reducing. Studies now show that there is a component of the oral microbiome, especially the microbiome living on the tongue, capable of reducing nitrates. And when that happens, nitrates become nitrite, and then eventually into nitric acid, nitric oxide, and that is a vasoactive. That's a vasoactive molecule that results in relaxation of blood vessels, so reduces blood pressure. So there have been studies that suggest that maintaining healthy microbiome on the surface of the tongue can help with regulating or reducing blood pressure.
Wow. Well, that's kind of fascinating. You mentioned to me in our correspondence too, I want to ask you about this, that a nitrate-rich diet, is that what you said is possibly good for the mouth?
So based on on studies that found that nitrate reducing bacteria can help with maintaining or reducing blood pressure, subsequent studies were done to assess if supplementing with nitrate-rich food could also help improving blood pressure. And I'm at least aware of a couple of studies where they use beetroot juice as such a supplement to improve nitrate production because that's nitrate rich food.
Nitrate rich, yeah.
And that resulted in increase in nitrate reducing bacteria on the surface of the tongue, and eventually also modulated the blood pressure favorably, at least in patients who are a bit old. So of course more studies has to be done to confirm these findings, but it's very interesting and it's evolving. And I'm aware of a couple of products that have been launched that has nitrate in a chewing gum or in some other form.
Interesting.
So
yeah.
there is some work being done there, but the level of evidence is early. I mean, it's very early to make final conclusion. But this approach where we are using natural products, prebiotics, probiotics, to keep the balance of the microbiome rather than removing bacteria is really evolving, and we have more and more evidence every day.
Do you think it's also important too? You make me think about a lot of different things, like chewing. A lot of even holistic people say, you should chew your food 32 times, and all of these things. Some of it sounds like, it's like kind of, hocus pocus. But, obviously in nature and animals, they chew their food. A lot of us, we're busy, talking, reading, watching TV, and just like shoving the food down, not even really, breaking it down. I mean, is there a whole thing about the saliva? All those things that
stimulating saliva could be, but I think it's mostly the nature of food rather than how much you chew. I mean, if you are chewing sugary food, or mostly
there's no benefit.
Sugar. Then if you're eating fibrous food like vegetable, fruit,
yes, right.
Then just by the means of mechanical cleansing, that's on its own is beneficial.
Is it better slightly alkaline diet for the mouth, would you say? Because overall in health, that tends to be the case versus an acidic diet, like where either it's a lot of meat or sauces. I don't know. I mean, do you?
Now, it is less clear how alkaline diet would affect the oral health. I mean, we know that acetic acid, sugar intake, that also ultimately results in reduction in more acidity or more acid production in the oral cavity. Adversely affect oral health by stimulating acid-producing bacteria to produce even more acid to result in cavities, dental caries, sort of thing. But increasing the pH could be also not a good idea because certain bacteria. Sorry for that.
It's okay.
Certain bacteria that are involved in periodontal disease tend to love a high pH or some alkaline pH.
They like an alkaline pH. Really?
Yeah.
Okay.
So I'm not sure how much work has been done on this, to be honest, and how and if there is anything such as alkaline diet, I'm not sure. So I'm not very familiar, but I would put a question mark on this because we need to do lots of work before we can. So what are the consequences of having a slightly high pH?
Okay. Let's talk about systemic medical diseases. That gets a lot of attention. It's actually how I came to contact you. There was an article in the New York Times on the health science section about oral hygiene is crucial to your health. Right. It's a little bit of the chicken and the egg type of thing. I mean, it's pretty important. Some pretty serious medical conditions like diabetes, heart disease. They even mentioned dementia.
Right.
So is it that the poor oral health contributes to these diseases, or is it the other way around? People that have these problems will present with poor oral health.
Poor oral health. Actually, it's both ways, and it depends on what disease we are talking about. So let's start with saying that if you go through the literature, you would see an explosion of studies that claim that oral health is involved in some way or another in disease A, B, C.
Well, let's say like cardiovascular disease. There's been a lot of attention to that, saying, you go get your cleanings, take care of your teeth, because you're putting yourself at risk for atherosclerosis, which is a pretty serious statement. Now, the way I make that connection, again, going back in my medical training, was that back in the day, really a little bit before antibiotics, which is again way before my time, but patients that had very poor dentition, whether they lost teeth or whatever, too, could sometimes present with what's called fevers and weakness, and they had what's called subacute bacterial endocarditis. They had actually,
Right.
from the gums, this is for the listeners, the bacteria from the mouth actually got into the
Yeah.
heart. How does that happen, by the way? What's the pathway from the gums just through the circulation that it gets back into to
Yeah,
the
I mean,
heart?
for specifically in the case of infective endocarditis, is direct access of bacteria to the bloodstream and getting all the way to the heart. But getting back to your
Yes.
to the broader topic, which is the connection between oral health and systemic health. If you go by by the literature, you'll find a long list of diseases that have been connected to oral health. Long list. It could be in hundreds, maybe. But if we weigh evidence, then we can start to shortlist and keep it a very small list of systemic disease where we have, I would say, moderate evidence for a link or a connection between oral health and systemic health. So I would name these. The first is, as you mentioned, atherosclerotic cardiovascular diseases is one where we have at least moderate evidence for the association, and then diabetes is another disease, certain types of cancer, respiratory tract infections, and then adverse pregnancy outcomes. The evidence is a bit weaker, but there is now more studies that add up to the evidence. So these are the more and to some extent there is also some actually considerable work that has been done on the relation between, or the association between, oral health, specifically certain oral bacteria, and neurodegenerative diseases, Alzheimer's in particular.
Okay. You also were co-author on an editorial about the human microbiome and cancer. Did any of this really relate to the mouth? Because I'm looking at it. In the first paragraph, you and your co-author, Dr. Morin, mentioned that there's
Gary
evidence
Moran,
of
yes.
fungal etiology for pancreatic cancer has been proposed. Again, I don't know how much that's been supported. We know there's always been concern about H. pylori with gastric cancer. And how about even mouth cancer, which is on the rise now? I mean,
Right.
there's been some celebrities that have had throat cancer and HPV supposedly related.
Yeah.
What's
Yeah.
going
I
on with all
mean,
that?
HPV-related oral cancer in young individual is a special entity. So that's a unique type of oral cancer, oropharyngeal cancer, that is related to HPV and sexual behavior. So it's different from the broader type of oral cancer that is mainly caused by other lifestyle habits like smoking, smokeless tobacco use, and alcohol. Now, probably many people are already aware of these risk factors of oral cancer, but there is emerging evidence that oral bacteria can even also contribute to the disease process. And there have been lots of work done on this, including by my group. And it's not only oral cancer. There is also, as you mentioned, pancreatic cancer, where there have been some evidence to suggest that certain oral bacteria are associated or could be linked or implicated in. And the other very important type of cancer that has been also linked to oral bacteria is colorectal cancer.
Colorectal cancer is related to.
Yeah, so as a specific bacteria from the oral cavity called fusobacterium nucleatum,
Yes.
has been studied extensively in the context of colorectal cancer. So,
And do you think that also, let's say, a lot of people socially drink, and they A lot of times they're swishing the alcohol around their mouth as they learn to be fine wine tasters. And fortunately, most people
Yeah.
are not smoking cigarettes as much anymore. I don't know if there's any issues with marijuana, but I mean, what is it with the smoke that it actually damages the cells, the DNA in the mouth?
Yeah, I mean, it's both smokeless tobacco and alcohol can induce genetic mutations, especially when they're together. And you mentioned about switching with alcohol. There are certain types of bacteria that can convert ethanol into acetaldehyde, and
Right.
acetaldehyde is a carcinogen. So this is one mechanism by which bacteria is thought to contribute to oral cancer by conversion of ethanol into acetaldehyde.
Oh, wow.
Yeah, another mechanism by which bacteria is thought to contribute not only to cancer but to many other systemic corrections, including diabetes, including cardiovascular diseases, adverse pregnancy effects, is through inducing chronic inflammation. So by having all these bacteria below your gum and resulting in gum disease, and gum disease, peritonitis, is a very chronic disease that lasts for years and years, and that produces molecules or inflammatory molecules that go into the blood and keep challenging and stimulating cells of different organs around the body. And this is how, or an additional mechanism by which people think that oral bacteria can contribute to systemic disease is through chronic inflammation.
Okay. All right. So I'm going to wind down this interview, which is really fascinating. Dr. Al-hebshi, how would you advise our listeners, or if some celebrity came to you and said, I want to have the best opportunity to take really good care of my mouth so I don't lose my teeth later on and I don't get all these other medical conditions, what would be one or two pieces of advice you would tell them?
I mean, I would stick with the standard of care again for now. Going to the dentist twice a year to do your prophylaxis, sticking to and using your toothbrush and your preferred toothpaste. Flossing would be the standard of care for sure. But following with and keeping updated with what's going on with recent research about use of probiotics, prebiotics, and if something comes into the market and is approved by FDA, it's something that we can consider long term. Again, keeping healthy diets, fibrous diets, maybe nitrate-rich diets based on what's has been published so far, could also help.
All right, I'm going to add one thing of my own, and I'm not a dentist or have your background, but one thing I think I did learn over the years, which you may find interesting. Earlier on in my 30s or 40s, I would go for the dental cleanings or appointments and go, oh, your gums don't look good. You're brushing too hard, da da da. And I ended up going to an electric toothbrush, which I really like because I like to think now as the teeth and the gums as the teeth as fine china. Like you never want to brush your fine china, this women will understand this better than men, by scratching it or doing it too hard. You want to do it just enough so it's clean and shiny, but not irritated. And since I've been using one of those, like, I don't know if it's a Braun electric toothbrush, when I go for my dental checkups, they're much better now because I'm doing it very carefully along the gum line, but not looking to irritate the gum line and hopefully breaking up the bacteria. And of course, trying to regularly floss, which earlier in my life I didn't do. I didn't understand the importance of it. But I think there's a saying once someone said, yeah, you don't have to, only don't floss the teeth that you don't care about losing. So if you want to keep your teeth, make sure you floss your teeth, right?
Exactly. I mean, and the choice between a brush or an automated a manual or an automated electric toothbrush is a matter of preference. But again, it's all about the technique and how you use either this or that. And the dentist is the best one to advise on how and to teach the patients how to use it appropriately. Otherwise, be it the manual toothbrushing or the electric, can if you use it aggressively with lots of force, can hurt the teeth.
All right. Dr. Al-hebshi, thank you so much for taking the time today. This was really illuminating. I'm sure our listeners have gotten a lot out of it. I know I have, and appreciate your time.
Thank you very much for the opportunity. It was a great pleasure having this chat with you.
Thank you.